Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight, webinar where, as you know, we're going to talk about Lyme disease. I look forward to seeing what you have in store for me tonight with your questions. None of these webinars are ever the same because we create them each time with your questions, so feel free to ask those. For those of you that are here for the first time, welcome. I'm glad you're taking a chance and trying this out. The way you participate is two ways. Number one, you can listen to the questions as I read them. If you're in a live webinar, you actually be able to see the questions on the screen too, but I will read them because in a recorded version, you can't see those questions. But one way to participate is listen to the questions and see the answers that I give. The other way to do this is to actually write a question to me. And you can do that through the chat box at the bottom of the screen. You write your question to me there. The only thing I ask as you write that question, do not hit the enter key until the whole question is done. So you have to write your question as a big run-on sentence, okay, or run-on paragraph, actually. If you hit the enter key, it actually sends separate questions to me, which gets to be kind of hard to follow from my side. I also see a number of familiar names. I'm glad to see that you're back here again. I'm glad to see you keep getting some value out of this, and we'll see what we can do for you again tonight. So for everyone, as you know, I record these each week. Sometime tomorrow morning, around, hopefully by 9 to 9:30 a.m. Pacific Standard Time, I will have those responses or the recording sent out, or an email announcing that it's done sent out to you. And in that email, you can also take the chance to sign up for the webinar next week. So this is one of 3 webinars that I'm going to be doing. Next week's webinar will be a Wednesday night webinar instead of Thursday. You're starting probably to see a pattern of that. For some reason, I keep having conflicts on Thursdays. So when I do have a Thursday conflict, I will move it to Wednesday. So next week's webinar is a Wednesday, and then the one after that, following after that, will actually be a Thursday again, okay? So I think without any further ado, we'll go ahead and get started here. I'm going to take the first question. This is a question from David. Hi, David. Let's see. Hi, Dr. Ross. Are you recommending the updated COVID booster to your patients? Any thoughts regarding the new booster? Yeah, it's early for me to say. Obviously, as you know, I don't know the reactions people are getting to the new booster. I do think it does make sense to get the new booster, especially if you're in areas of the country where we're having a lot of COVID still, and it happens to be a lot of the country. They are predicting as we head into the colder weather in the winter months that we may get COVID surges again. And part of the reason for that is going to be we're going to have a lot more contact with people again as we're moving indoors and having to breathe the air of other people. I do think it makes sense to get this booster because it does have it's a booster that's made against the original COVID strains, as well as the recent COVID strains that we're having. So it should match a little bit better COVID that is out there right now. Unfortunately, as you all know, the COVID vaccine does not prevent you from getting infected. And so we still have people getting infected. It does do a good job, though, at keeping you from getting bad illness. And so for that reason, I still am recommending it. I know that there are the anti-vaxxers out there that have always come after me for doing that, but I still think that the ramifications of this disease are much worse than any ramifications of the vaccine. That's my opinion on this, okay? Now, if you are a person that had the previous COVID vaccine and did have a bad outcome from it, obviously don't get the vaccine again, okay? But if you are a person that tolerated it well, and you are a person that wants to be out and involved in your community and not have to wall yourself off inside, I am recommending it. Okay. All right. Thanks for that question, David. Good luck to you. Hello, Gail. Let's see. Hi, Dr. Ross. I'm taking otobabark and cat's claw up to 20 drops a day of each. I'm about to add Hutinia and Siddha Lyme literate naturopathic doctor wants me to try methylene blue lipospheric, but only 10 milligrams to start since I am sensitive. Hopkinton Pharmacy can't make it below 25 milligram. InfuServe can do 10 milligrams, but it would only have almond oil and methylene blue in an enteric coated capsule. 1. Should I not use methylene blue if I'm currently only on 2 herbal antimicrobials? 2. Is methylene blue with almond oil considered it lipospheric and protect my stomach lining, etc.? 3. Is it okay to take all 4 herbs at the same time? 4. Do you see methylene blue irritate your patient's bladders? And 5. Does it kill Lyme? Okay, so let me kind of just say a few things about methylene blue. So methylene blue is a medication that we have repurposed to treat Lyme and Bartonella, specifically growing Lyme and Bartonella and persister Lyme and Bartonella. It may also have some activity against Babesia as well, too, although I don't think it's the strongest Babesia agent, okay? What it is designed to do, what it's actually approved to do, is we use it as a medication for people that have a problem with their hemoglobin. The hemoglobin is the protein in the middle of your blood cells that holds onto oxygen so that your blood cells can carry oxygen around the body. There's a group of people that, a small percentage of people have a problem where their hemoglobin doesn't let go of the oxygen. So they become oxygen starved and they actually turn blue. Okay. And that seems to get worse when they're under stressful situations, either physically or from a medical problem. And so sometimes when the people are in a crisis because they're actually blue and they're not oxygenating their tissues, they go to the emergency room, and in the emergency room, you get a shot, an intravenous injection of methylene blue. And what it does is it bumps oxygen off of your hemoglobin and resolves the crisis. Okay, so that's what it's designed to do. We do know from laboratory experiments, not human experiments, but laboratory experiments, that it does get inside of the membrane of germs and can destabilize them, making it so that they'll fall apart, basically. And because it destabilizes a membrane, it doesn't matter whether the germ is growing or if it's hibernating like a persister. So it can work either way. We do have good evidence from the labs that it does do a good job with Bartonella, and good evidence that it does a good job with Lyme. Okay, and yes, I do use it in my treatments. I tend to use it more as my persister agent because as many of you know, I try to design Lyme and Bartonella treatments so that it cover growing phases of the germ, which is probably 90% of your germ or more, and these hibernating non-growing phases, which are about 10%. I try to give something that's going to deal with persisters. Methylene blue is an option to do that. I will also tell you on the Lyme side, regarding those persisters, if you are doing cat's claw has got some laboratory evidence that it can treat persisters too, just so you know. I do not know, because no one's experimented to see if Herxheimer or cytokines do anything for persisters for Bartonella, all right? All right, so methylene blue, one of the side effects, so to answer your question 5, does it kill Lyme? Yes, it can kill Bartonella too, okay? And growing and persisting. Okay. Your 4th question was, does methylene blue irritate patients' bladders? There are a small percentage of people that methylene blue does give bladder irritation. Not everyone, and you really won't know until you give it a try. I have had one person that's gotten some GI irritation out of it as well too, with some intestinal cramping on it that got better as we reduced the dose, basically. Okay. Can you take all 4 herbs at the same time? And I think by that you mean cat's claw, Otoba, cytokines, Herxheimer. Yeah, those all 4, I have people take them directly at the same time. You can either squirt them all in your mouth at the same time, you can put them in a glass of water, mix them together, but it's okay to take them all at the same time. Let's see. In terms of methylene blue, one of the problems with methylene blue is you have to get it absorbed into the body, okay? And but there's only a handful of pharmacies in this country that even deal with it because it's messy. It's a blue powder that goes over everything and stains everything. And actually, if you do take it, it actually turns your urine blue and your stool blue. And and when it gets into your toilet, it's extremely hard to get off. You even have to scrub it really hard. So this stuff is some nasty stuff, especially for labs to work with and pharmacies to work with. Okay, so I think from what I understand, from what I've been able to find, there's only about 3 pharmacies in the country that will actually do this. One of those is Hopkinton Pharmacy. Another one is InfuServe down in Florida. Hopkinton's in Massachusetts. And then there's a lab in Cedar Park, Texas, right outside of Austin, called PD Labs that does it as well too. Now, all of them are choosing to mix it up in some kind of oil to get it better absorbed. And they call it liposomal, but it's truly not liposomal. Okay, so a liposome means that you take a bunch of fatty acids and you use them to form a bubble around the medication so that it better gets absorbed, okay? But what these pharmacies are doing, even though they're calling these liposomals, they're basically just blending the methylene blue with oil to increase its absorption, and it probably does increase the absorption. As to whether it matters if it's almond oil or other oils, it doesn't matter, actually, as far as I'm concerned, okay? And the truth is, no one, either Hopkinton or InfuServe or PD Labs, no one's done science showing that the absorption of their materials. I haven't seen that data. I'm not aware that they've done that kind of information for, or that kind of studies for us either. So in other words, is it okay to do the almond oil? Yeah. And even if they're not calling it liposomal, it probably doesn't matter. They're blending it. They're blending it in oil to get it better absorbed. So it's not a true liposome, okay? And then finally, let's see, should I use methylene blue if I'm currently only on 2 herbal antimicrobials? Yeah, you can add methylene blue in as your persister agent, okay? So again, to kind of cover the theory behind that, in the last 5-6 years, we've started realizing that one of the reasons Lyme and as of about 2 years ago, we realized this with Bartonella too, that one of the reasons that these germs may be hard to treat is that that there are 2 growth states of the germs. There's growing, and then there's hibernating persisters. These hibernating persisters literally stop growing, slow their metabolism down, and ignore the standard antibiotics we throw at them, okay? And so if you're only using standard antibiotics, you develop all these persisters, and they can come back or they can keep you infected, basically. So in the last 5 years for Lyme, or 6 years for Lyme, and about the last 2 years for Bartonella, most of us realize this, and we're trying to do things to deal with persisters. The way I do it is I try to put people on something that covers growing phases and something that deals with the persister phases at the same time, okay? And so adding the methylene blue in is going to give you some coverage on the persister side. You can add it to the 2 herbal antimicrobials that you're currently on, all right? All right. And then everyone that's new to this, the otoba bark and cat's claw are 2 herbal medicines that do a good job based on petri dish experiments killing killing Lyme spirochetes, Lyme cyst, and breaking up biofilms, which are slime layers that cover the germs. There's more recent research showing that cat's claw can also do persisters too. The Houttenia and Sitta acuta are 2 herbs that come to us from Buhner, as in Buhner herbs, and they tend to be good agents to work for Bartonella. And usually, if I'm going to design a Lyme treatment, I'm going to pull otoba and cat's claw. For Bartonella, I'm going to use Houttenia and Sitta acuta, and then I'm going to do something for persisters. My go-to persister agent actually is another herbal medicine, and that is I tend to use something called liposomal cinnamon, clove, oregano capsules. Based on Johns Hopkins research, those oils are all good against persisters. They even can help the growing phases. The Hopkinton Pharmacy that you mentioned here actually makes a product under a brand called Doctor Inspired Formulations called liposomal cinnamon, clove, oregano essentials, and that's 1 pill twice a day. But if you're not going to do that, another alternative is to do the methylene blue to deal with your persisters. Okay, all right. That's a long-winded response there, Gail. I hope that gave you the information you needed. Okay, all right. Good luck to you. All right, so I'm going to do a quick screen share here, everyone. I'm just going to show you some resources. Okay, so this is my Lyme disease information site, Treat Lyme by Marty Ross MD. And so in terms of some articles, if you need more information, underneath my infection treatment plan section here, There is an article I have called How to Treat Persister Lyme and Bartonella. And in here, I review various options, including methylene blue, including the liposomal cinnamon clove oregano. And this article, actually, I just recently edited it again as I'm getting it ready to go into the book that I'm writing right now. That will be a compilation of my treatment plans and my thoughts on various alternative medicines. And so I know many of you have been heard me saying something about that, but the book's about 3/4 written now. I should be able to get it to a point that I'm going to get it off to the editor in about 2 weeks and off to a graphic artist to do my cover design. But that book's coming along. But this is a current article, okay? And then in terms, and I describe the methylene blue in this article as well too, okay? All right, and then just to kind of give you an idea of what I'm doing to design my treatments these days, take a look at my Lyme disease treatment protocol, and you'll see in the Lyme infection section here, part 11, where I say I'm using Otoba and cat's claw as an herbal option, and I'm using the cinnamon clove oregano to go after persisters, okay? I also give you prescription options as well, but in the prescription option to go after persisters, I'm using liposomal cinnamon clove oregano, okay? And then in the Bartonella section, down here, wait a minute, that's Babesia. In the Bartonella section here, herbal, I say do the Hutania sitacuta, and cinnamon clove oregano is one of the options you could do for the persisters as well too. Okay, all right, all right, all right. Let's see here. Hello, Shanna. Let's see. I think I heard you say to take probiotics once a day, 2 hours away from antibiotics, either before or after. I feel like I have to take it 2 hours after each antibiotic dose based on my assumption that each antibiotic dose will kill good and bad bacteria. So it would negate the probiotics if probiotics are taken before. Where is my thinking off? So I haven't exactly said, maybe I've said 2 hours, but the idea with your antibiotics, you're correct in raising the concern that if you take an antibiotic near a probiotic, you may kill it, okay? Keep in mind that a lot of the antibiotics you take don't necessarily work just near the time you take it. They may work throughout the day or hours, okay? So for instance, azithromycin will be in your system. That pill you take is still in you and having effect for 7 days, okay? What I was recommending, though, is your best chance for your antibiotics to work is to take, or your probiotics to work, is to try to take them as far away from antibiotics as you can. So for instance, if your antibiotic regimen is twice a day, you take antibiotics in the morning and you take them at night, then somewhere in the middle of the day, you want to take your probiotics. And at a minimum, if it's really hard to squeeze them in, try to take them at least 2 hours away from your antibiotics, all right? And that's not ideal, and that could be before or after. I don't think it really matters, but the issue is take it as far away as you can. Now, even if you just don't want to take them directly at the same time, okay? But as you take them far enough away, they're going to have a chance to work, basically, okay? All right, let's see. Well, I say a little bit about Sacro B and also know any MD, FM, Bart docs in Florida. I'm in the Orlando area. So regarding who's down in Florida, I don't personally know any of the doctors down there. I know that there are starting to be a growing number of doctors down there that have trained with ILADS, the International Lyme and Associated Diseases Society. A number of them are integrative medicine physicians. And what I would do is contact ILADS. So you can go to ilads.org onto their contact page. And in there, they have a tab that you can use to request providers near you. Again, I can't speak for how any of them work or their effectiveness, but I do know there's a number that are doing integrative medicine down there, okay? Okay, so in terms of Saccharomyces boulardii, so there are, let's just do a quick talk about probiotics in general. So there are a few different categories of probiotics. There are probiotic products that use human strains of bacteria. These would be the common bacteria that are found within your intestines. And these would be strains made up of something called lactobacillus, and something called bifidobacterium. Those would be the human strains that you would find in many probiotics. Okay, so one kind of lactobacillus, for instance, is Lactobacillus acidophilus. I think most people have heard of acidophilus. All right. Okay, so there's human strains. All right. There's also another group of probiotics that are known as spore-forming probiotics, and these tend to be soil-based probiotics. These are germs that come from the ground. All right. And these spore-forming probiotics, because they develop a spore over them, do a good job of getting through the acid of the stomach. The human strains can't do, they just have a harder time. But the spore formers get through there. We don't have any science showing that the spore formers actually populate the intestines. The human strains can populate. But what the spore formers do is they help the human strains populate, and they help the existing bacteria in your intestines to work better. Okay, all right. So at a minimum, I like having people these days do a product that has human strains and has spore-forming strains in it. Okay, all right. And so, for instance, one way to do that, there's a product made by Research Nutritionals called Multibiome. And Multibiome is made up of human strains. It's also made up of spore-forming strains, okay? Another way you could do it would be to take a product that is just human strains, and for that I like a product called HMF Forte. And then you could combine that with a soil-based product like a Megaspore, for instance, or you could combine it with Research Nutritional's product called Probiotic. That's a soil-based strain, okay? All right. Now, the other major group of probiotics is a product called, is made up of something called Saccharomyces boulardii, all right? Or we shorten that, we call it Sacro B for short. Saccharomyces boulardii is a yeast, a healthy yeast, not candida yeast, the bad kind of yeast, but a healthy yeast that also is found in healthy functioning intestines, and it helps them work better, all right? Now, I tend to reserve using Saccharomyces boulardii for people that I've got on human and probiotic strains, and let's say that they're having loose stools, probably because they've got some imbalance of their bacteria and the makeup of the intestines. Sometimes adding in Sacro B can help with that, okay? That's one situation I'll use it. The other time I will add Sacro B in is if I've got a person that has a history of having had an infection in the intestines called a C. difficile or Clostridium difficile. C. difficile is a bacteria that lives in our intestines normally, but when you take antibiotics, it grows too much. Yes, when you take antibiotics, it grows too much, okay? And if it grows too much, it releases a toxin called C. diff toxin, and that gives you diarrhea. And if you get C. difficile, we have to stop the antibiotics until we get rid of the C. difficile, and then we can go back on antibiotics again. But if I've got someone with C. diff, I put them on Sacro B. Sacro B has got some evidence showing it actually can help treat C. difficile, in addition to some antibiotics you want to use for that, okay? But the other benefit, if you've ever had C. difficile diarrhea, is it tends to prevent it from happening again, okay? So I will use a Sacro B. One of the reasons I'll use it is if a person gets C. difficile diarrhea, I will use it as part of that treatment. Thorne makes a product called Sacro B. I'll have people take 2 pills 1 time a day. The other situations I'll use it if I've got somebody that had C. difficile diarrhea, in addition to doing my human strains and spore-forming strains, I will have them take 2 Sacro B a day, okay? And then let's say I've got somebody that just has a lot of problem with bushy stools while being on antibiotics, and I've got them on good human strains, spore-forming strains, and they're still having mushy stools, then sometimes I will add in Sacro B at 2 pills 1 time a day to see if we can help with that as well. Okay? All right. I hope that answers your question. Good luck to you, Shanna. So for everyone that's wondering, wants a little more information about probiotics and what I just said, I've got an article called Probiotic Strategies. I believe that's what I call it. Here, let's see. Probiotic Strategies in Lyme Disease Treatment. And if you want to read more about what I just described, you can find it here in this article. Okay. All right. Let's see here. Hello, Mary. Let's see. Hi, Dr. Ross. Thank you for all you do for us. You're welcome. I have a 20-year history of Lyme, Bartonella, and Babesia. 1 year ago through Igenics, I had a positive Babesia fish test and positive Bartonella immunoblot. Last month, I was advised to stop antibiotics while I treat yeast. I recently repeated my labs. The Babesia fish is negative, Bartonella IgM negative, and IgG indeterminate, Lyme immunoblot negative, and IgG positive with band 234141. Is it urgent that I treat tick-borne illnesses now, or should I wait a few months while I treat the yeast? All right. So let me say, if there's a number of things I need to say about this. Okay. So first of all, if you have active Lyme, if you have Lyme in you and you stop, and I'm talking just the Lyme germ, Borrelia Lyme, not Bartonella, not Babesia, just Borrelia, okay? It is okay if Lyme Borrelia is active in you and you stop treatment periodically to try to get rid of yeast. We think that the Lyme germ grows extremely slow. Some estimates say maybe even every 4 weeks. And therefore, if you stop a treatment and you're in the middle of a Lyme treatment, it's not going to grow back rapidly. Okay, it can sometimes take 7 to 8 weeks to even get resymptomatic again from Lyme. So for the Lyme germ, it is okay to take a month break or so here and there. Okay. Bartonella and Babesia, on the other hand, if they are active in you and you stop a treatment before you're done treating them, they may come back pretty quickly. Both of those germs replicate about every 24 hours. And so within a week to 2 weeks after stopping treatment for them, they will have rebounded and they will be all the way back again. Okay. Now, so that's I just wanted to know that. Okay. All right. Second point, there is not a adequate way from testing standpoint to prove if your germs are gone. Now, I will admit the Babesia fish test that you had done is a microscope exam that uses a fluorescent agent that attaches to the DNA of the germ. And in theory, if you're not seeing it with that, that means the germ is gone. Okay, in theory. However, for the fish test to be positive, you got to have a lot of the stuff in you. So you could still have a little bit of Babesia in you and have a negative test. All right. So having a negative test does not prove it's gone. I want to be clear about that. These immunoblots that you're looking at for the Lyme and the Bartonella are basically measuring whether you're having an antibody reaction. And the trouble is, you can't rely on that to tell you if the germ is active or not. So if you've ever had antibodies against the germ, you will keep making antibodies even after the germs are gone. Okay? Having a negative antibody test could be that the germ is out of you, or it may be the germ is causing enough immune suppression that you're not making antibodies. All right. So you can't use the test. Unfortunately, in all of these conditions, we do not have a test that proves the germs are gone or that the volume of the germs is way down. They're not accurate. There's no accurate way to test and see if the germs are active in you or not. The best way to find out if germs are active and bothering you is to follow the symptoms of those germs. All right. So for instance, if you had a lot of symptoms of Babesia with your Babesia and they're now all gone, those Babesia symptoms are gone, then it's probably safe to stop treating the Babesia. If you had a lot of symptoms of Bartonella and now they're all gone, it's probably safe to stop treating the Bartonella. Okay. So what are the symptoms of Babesia? Babesia often will give you night sweats, air hunger, headaches in the front of the head, heart skipping and racing, low blood pressure when you stand up. Those tend to be Babesia symptoms. Bad fatigue, that tends to be Babesia, okay? Bartonella symptoms can be things like pain on the soles of the feet, severe cognitive impairment. Air hunger can be part of Bartonella as well, too. Neurologic conditions, neuropathies, so numbness or nerve pains, tremors, shakiness, sometimes bladder irritation. If those were your Bartonella symptoms, the majority of them are gone, then you're probably fine, okay? Also, in considering whether it's okay to stop a Bartonella or Babesia treatment depends on the length of time. A typical Babesia treatment is going to require 4 to 5 months. If you're stopping your treatment before 4 to 5 months, you're going to stand a good chance of relapsing on it, okay? A typical Bartonella treatment length is going to be about 4 to 6 months. If you've stopped your Bartonella treatment, you're only 3 months into it, there's a good chance it's going to come back, okay? So those are just some rules of thumb there. And again, unfortunately, I know my colleagues are out there retesting, and I think it's ridiculous. We as doctors think we need proof of something, okay? But you have to look at what the science says about antibodies, and that we really don't have an adequate way to prove these germs are gone, okay? Again, not having any antibody reactions, so your immunoblot being negative, does not prove the germ isn't there. It could be from immune suppression triggered by the germ, okay? And likewise, having a negative fish test, although there's a good chance that may be real. Sometimes if you have low numbers of Babesia, it just won't pick it up. So that's not proof that it's gone either, okay? All right. Good luck to you, Mary. Let's see. I want to make sure I answered all your question here. I think I did. I don't think I gave you the easiest answer, but I did answer it for you. Okay. Good luck to you. Hello, Colleen. Let's see how Dr. Ross. I just began treating yeast overgrowth with phytostain and probiotics, plus 3 drops each, 1 time a day of Cemento, Hutania, Cryptolepis, cat's claw for Lyme, Babesia, and Bartonella. And I intend to treat the yeast for 3 months. Taking 1 pill of HMF Forte, 1 pill Corbiotic Sensitive, and 1 pill Regactive Essential, which is a glutathione synthesizing lactobacillus bacteria. Does this sound good, or could I drop one of the probiotics? 2, should I stop the 3 drops of herbal antibiotics during this time, or is it low enough dose that it's okay? And 3, is it okay to take 1,000 milligrams D-mannose per day during yeast treatment? Prior to this, 1/3 cup prune juice per day kept me regular, but I stopped the candida diet and immediately got constipated. I've struggled trying numerous things to constipation in the past, and nothing helped much without the prune juice. Would 1/3 cup prune juice per day make the candida treatment fail? Does a yeast Herx follow similar pattern to a Lyme Herx? Okay, that's a lot of questions. Let me see what I can do here. All right, so Herxing, everybody, is a reaction you get when you kill germs, okay? You can get it from killing Lyme germs. You can get it from killing yeast. And basically what happens is the immune system sees the dead germ parts and reacts by making more inflammatory chemicals called cytokines. All right. When you feel bad in Lyme, the main reason you feel bad is that your immune system makes too many cytokines. Cytokines are good and bad. On the good side, they cause more immune cells to be made. They draw the immune cells to where an infection is, and they help those immune cells work better to get rid of the infection. But if the immune system isn't doing a good job dealing with an infection, it will make more and more cytokines, and that eventually gives you what we call Lyme symptoms, okay? So Lyme symptoms are excess cytokine symptoms. Excess cytokine symptoms are fatigue, body pains, insomnia, hormonal dysfunction, you name it. What we call Lyme symptom, those are excess cytokine symptoms, all right? So now when you start killing germs, the immune system is going to see all these dead bug parts and make more cytokines. So your underlying cytokine symptoms are going to get worse, all right? That's what a Herxheimer reaction is. And usually what a Herx looks like to you when you kill your Lyme germs is the same that a Herx is going to look like to you when you kill yeast. They're pretty similar reactions, basically, okay? All right. Now, in terms of what kind of diets to consider when you're trying to get rid of yeast, usually what I recommend is that people avoid doing simple sugars as much as they can as part of any yeast treatment. So that's the obvious sources where you dump a lot of sugar into something. So that means no cookies, candies, cake, ice creams. And generally I recommend against fruit juicing and also against vegetable juicing, because the juicing is straight sugar as well too. Right now, In terms of the prune juice is great for constipation because it's full of fiber. And that's how prune juice works. It's fiber that helps with the constipation. But the trouble is it's also a juice. And as I just said, your juice is going to be feeding your yeast. So generally, I try to avoid juicing as part of treating yeast. You may need to consider other ways to increase the fiber in your diet, okay? So you could, the pharmacies are full of fiber products that you can use to loosen your stool. You could even do a synthetic fiber called Miralax to loosen your stool. But I would look at other fiber sources rather than using the prune juice if you're trying to get rid of yeast. At least that's what I would recommend if you were my patient, okay? All right. Now, in terms of this probiotic regimen that you have, as I said, I usually try to go for a human strain along with a spore-forming strain. And in your case, that would be the HMF Forte and the Corebiotic Sensitive. But I would probably do each of those as 2 pills one time a day. So I would bump those up, okay? In terms of the Regactive, I'm not familiar with that product, and I don't necessarily think you need it either, to be honest. I don't think you need a glutathione synthesizing lactobacillus. I think you could probably get rid of that one. Let's see. In terms of can you use the herbal antibiotics and treat yeast at the same time? Yeah, I think you can do that. And I think at the levels that you indicate here of the herbal antibiotics that you're using, I don't think they're going to cause a significant problem getting rid of your yeast, okay? Keep in mind that some doctors use more of a theory that herbal antibiotics don't lead to yeast at all. That's not my experience. I think that some of these herbal antibiotics can lead to yeast, but they have a harder time leading to intestinal yeast overgrowth compared to prescription antibiotics, okay? So I think that the levels that you've said here, I think you'd be okay. Let's see. So the D-mannose, everyone, D-mannose is a sugar that coats the urethra. The urethra being the tube that comes from your bladder and goes to the outside. You pee through the urethra, okay? And there are some people that have problems with getting recurrent bladder infections from a bacteria called E. coli. And if you put D-mannose in there, it makes it so that their skin, the urethra skin, will not hold on to the E. coli as well. And so they tend not to get as many infections. And if that's what you're using it for, fine. I don't see a problem with mixing the D-mannose with what else you're doing here, okay? No, I don't think your D-mannose is going to feed your yeast, if that's what you were trying to ask. I think I just got through your whole thing. All right. Good luck to you, Colleen. Hello, Heidi. Hi, Dr. Marty. Do you find that POTS-type symptoms are more related to Lyme or Babesia? And do you see it improving or going away with treatment? Thank you for your time and awesome expertise. You're welcome. So, of the three major infections, and granted, there's a number of other infections that get transmitted by ticks, but I call the 3 major ones being Borrelia, which is Lyme, Bartonella, and Babesia. Babesia is the one that has more associated with POTS than Lyme. Lyme can still cause it though. Okay. So everyone, POTS stands for paroxysmal orthostatic tachycardic syndrome. Okay. And basically what it means is you get periods where your heart starts racing or you drop your blood pressure just out of nowhere. What the reason for that is that a major cause of that is you get some dysfunction in what's known as the vagal nerve. The vagal nerve is a nerve that comes out of your brainstem, and it basically regulates adrenaline and anti-adrenaline. And if it gets infected by Lyme or if it's affected by Babesia, it can lead to imbalance, and you get surges of adrenaline and you get anti-adrenaline. And so you get heart racing, blood pressure dropping, you get sweating, you get air hunger, you get headaches. This is all related to that, okay? And so it tends to be, we see a lot more of that with Babesia than Lyme. Occasionally it can be part of Lyme. If I've got somebody that has a lot of symptoms of POTS, and those would be the same symptoms you see with Babesia, air hunger, heart skipping and racing, getting sweaty, blood pressure being low and then suddenly high, all those kind of symptoms, I usually will go for Babesia and see if I can get those symptoms to resolve. If not, then I start thinking they're probably part of the Lyme. Okay. All right. Good luck to you, Heidi. Hello, Becca. Let's see. Hello, Dr. Ross. Thank you for your webcast. Oh, you're welcome. Let's see. It helps a lot. Ah, good, good. Our doctor has just introduced Primaquine to our daughter's treatment regimen for chronic Lyme, Bart and Babesia, as well as herbal medicines. She's also taking sulfatrim, clarithromycin, and Malarone. Have you had experience with this combination of meds? Are you in favor of using Primaquine? And if so, how is it most effective? Thank you. Primaquine, yes, I have used combinations like I probably have used an exact combination like this before, to be honest with you. So let me just talk about this. So the there are two general categories of treatments for Babesia. The strongest categories, prescription categories, fall into two families. There's what I call the atovaquone-based treatments, and there are what I call the quinoline-based treatments, okay? So atovaquone is a medicine, is an antiparasitic that kills Babesia, or an antimalarial antiparasitic kills Babesia and malaria. And atovaquone is found in atovaquone generically, which is also known as Mepron, or you can find it as a combination product with in Malarone. Malarone is made up of atovaquone and a quinine derivative called proquinone. Okay, all right. So one way to treat Babesia is to use treatments that include an atovaquone medicine coupled with a clarithromycin or an azithromycin, sometimes even the Bactrim. Okay, that by itself would be a good way to treat Babesia. Another family of medicines, primary way to treat is to use what are called quinoline-based medicines, and those would be Primaquine is one. There's another one called tafenoquine as well too. And you usually have to combine the Primaquine or the tafenoquine with another antimalarial at the same time. All right. Primaquine, I usually like combining either with something called hydroxychloroquine, also known as Plaquenil, which is a quinine medicine, or I've increasingly have been combining it with either Mepron, which is pure atovaquone, or with Malarone. All right. So what I would say to you is she's pulling from a quinoline and a atovaquone-based treatment, and that probably is going to make some of your strongest Babesia treatments you could do. It can be quite effective. I want you to know that. And for Babesia, the addition in there of clarithromycin and sulfatrim is going to be help the Babesia treatment too. For Bartonella, the clarithromycin sulfatrim is a good Bartonella treatment. And then for Lyme, the clarithromycin is great at treating spirochete growing Lyme and Lyme that lives inside of cells. Sulfatrim may or may not help with persisters. But what I don't see here, I don't see any medication that's going after the cyst form of Lyme. So keep in mind, Lyme has 3 different ways that it appears, and then it has growth states, okay? And the best treatments go after both all the growth states and all the appearances of Lyme, all right? So Lyme can exist as a spirochete. That's the corkscrew-looking thing, all right? Lyme also can get rid of its covering and move inside of cells, and we call that the L form. And then Lyme also can form these microscopic round balls. We call those cysts, okay? Now, it appears that the cyst and the spirochete, we know from laboratory experiments, can be either in a growing phase or can be in these persister hibernating phases. We don't know for sure whether inside the cells, whether the germs are always growing or they can be hibernators. We just don't know from the data on that, okay? When you design a treatment, you want to make sure that you're doing something to go after all forms. And the clarithromycin is going to be useful at going after intracellular Lyme, which is the L form, and going after spirochete Lyme. But I don't see anything from what you've written here that says that there's anything going after the cyst form. Okay, so cyst treatments can be grapefruit seed extract. You can do tinidazole, metronidazole. You can do fluconazole. Those would be things that would go after it. But specifically from what you've written here, I don't see anything. Now, you may be on some herbs that are going after it, but I don't see it here. Okay, all right. So yeah, could this be an effective treatment? Yeah. It's a lot of drugs, and this one would require doing some blood testing periodically to make sure that her kidney and liver are holding up okay to it. But yeah, seems reasonable. Okay, all right. Good luck to you. Good luck to your daughter. All right, let me do a quick screen share here. All right, so in terms of what I just said about, you can kind of break the treatments down into these two families, atovaquone-based and quinoline-based treatments. Take a look at my Kills Babesia, a brief guide. Okay, and you'll see that that's how I've done it. Basically, is there's the atovaquone-based treatments here, and then there's the quinoline-based treatments here. Okay, and yeah, so that should give you the information there. Okay. All right. Hello, Frank. Let's see. You've previously mentioned there's a theory that some of the 10 to 15% of people that don't get better from Lyme or Bart have immune systems that have a hard time getting rid of the dead germ debris or the DNA of the germ, and so they keep reacting against it. If we want to test this in this case, is there a binder you recommend for this kind of debris, and how much time would you give it to see if you improve things? You know, what I've said in my article is we don't know how to get rid of the debris. You know, technically, your immune system is supposed to break down things that are dead in you and not needed anymore. And so, you know, a binder is something that would bind up things in your intestines. Binders are not going to get inside, absorbed and be inside of your bloodstream to bind up debris there. Okay, so no, I don't think that would work. I know I've been recently asked by another patient of mine that said, or a person that wrote to me and said she wondered if you could try enzymes to break down this debris. And that the answer is, I don't know. I haven't seen anyone do any science on that one to see if it would work. I would be skeptical though, because often this debris has to be broken down by the immune system. And for some reason, and we don't know why, the debris may not be being broken down by the immune system. Okay. All right. Thanks for that question, Frank. So everyone, let me just do a quick screen share here. I had written an article probably in the last 2 months about reasons that 10 to 15% of people may not get better. And I even proposed ideas about what could be done, what you might try based upon some of those theories, okay? And so that article is right here. It's called Why Chronic Lyme Treatment Fails, a Review with Strategies, okay? All right, and one of the ideas that is written about is that one of the reasons people may not fully recover is this germ debris theory, okay? But there's a number of other points that are raised in here as well, too. All right. Thanks, Frank. Good luck to you. Hello, Lynn. Let's see, Dr. Ross. My son, who is already taking BPC 157, just tore his medial meniscus. The tear is in the vascularized area of the meniscus. Might the BPC 157 help it heal? Are there any other peptides or other supplements that might aid in healing? Also, I think you mentioned that some people inject BPC for injuries. Any thoughts on how to find a reputable provider for this? I have heard some people, including one doctor, talking about BPC 157 perhaps triggering a mast cell or histamine reaction. Have you heard anything about this? Could it cause a yeast infection due to antibiotic activity referred to in a recent webinar? So I don't think I would see it leading to yeast. I would say that anything we give you can cause a histamine reaction, and it's called an allergy. Okay, I have not seen it happen overwhelmingly in people that have gotten injections. I don't do the injections here, but have gotten injections elsewhere or that take the oral product. So I think it's a low risk of that happening. I don't have advice for you about how to find a reputable person to do this. I don't know where you live, and I don't know who is in the area that's doing it. Okay, so that one I have a hard time saying. But in terms of things that you can do to repair injuries like this one is the BPC 157, which is a peptide, everyone, that's made by the stomach lining that seems to do a good job of helping do a number of things. One is it can repair injuries to tissues, whether that's nerves, muscles, tendons, joints. It seems to do a good job doing that. It also supports healthy balance in the immune system, and it helps mitochondria, or your cell energy factory, function. And it may have a very small antibiotic effect, but probably not a major one at all. Okay, all right. So does it make sense to that might help? Yeah, but he's already on it. Maybe you get a little stronger effect doing IV, but that's a maybe. I don't know for sure if you would or not. Okay. The other thing is you want to support the cartilage, and one way to support the cartilage, and the meniscus is made up of cartilage, is you want to take a building block for cartilage, which is something known as glucosamine sulfate. And that's a 500 milligram pill, and that's a 1 pill 3 times a day. So in situations like this, I often have people take the glucosamine sulfate as well too. The product I like for that is made by Thorne. Thorne is a pretty reputable supplement company. It tends to make good products. They source good materials for their products. Okay, all right. Good luck to your son, Lynn. Hello, E. Let's see. Hello and thank you. I'm still testing positive for Babesia oticoli after 6 months of Mepron, 5 to 7 milliliters 2 times a day, combined with a daily dose of 500 milligrams azithromycin and 10 milligrams of ivermectin, as well as 4 Baluchi. I am 110 pounds and no longer herx to any of the meds, but am unable to take the Primaquine. As such, I am wondering if you can suggest an alternative antimalarial RX that is just as effective as Primaquine. I'd rather avoid the mefloquine due to significant side effects. Thank you. All right. So again, Primaquine is in a family called the quinolines, and the other major newer member of that family is called tafenoquine. So yeah, I would look at tafenoquine if you can get it. And that's the problem. Tafenoquine is, which is the trade name that you'll find it is something called Krintafel. That's Krintafel. And that may even be more effective than the Primaquine. The difficulty is finding it. That's a hard medicine to come by. Or if you get it, the pharmacist may be able to give you enough for a whole month at the same time. Okay. Where you can find that information about tafenoquine, I showed you earlier tonight, the article that I have on Babesia. It's called Kills Babesia, Brief Guide. Take a look at that. I talked to you about how I dose tafenoquine in there. Okay? All right. Good luck to you. Hello, Dr. Ross, with an exclamation point. Appreciate the exclamation point. Let's see. 1, does the dose of herbal antibiotics consider the person's weight? For example, is 30 drops of Cascala twice a day suitable for both a 90 kilogram person and a 45 kilogram person? 2, when using fluconazole to treat fungal infection for 30 days, should herbal or prescription antibiotics be discontinued? 3, does it seem possible that IVIG somehow activates Lyme and co-infections? After the first cycle of IVIG for autoimmune encephalitis, erythema appeared for the first time. Thanks so much for all of your help. So IVIG, everyone, stands for intravenous immunoglobulins, or you're getting antibody injections, okay? You know, I have not, to answer your question, it's not my opinion, nor have I seen it reactivate Lyme before. It is possible that by getting that the erythema may be a reaction your body is having to receiving foreign antibodies, okay? So keep in mind, these antibodies are pooled together from hundreds of people that donate, and it's possible to have immune reactions to some of the components that are in another person's blood products that you're taking, all right? That's probably a great likelihood of what happened there, basically. But no, I haven't seen anything get reactivated before with that. In terms of when you use fluconazole, if I've got a person I've been treating with antibiotics and they get a secondary yeast infection in their intestines, I often will not stop the antibiotics and just add fluconazole in to treat their active yeast infection. And that's effective about 90% of the time. Now, if I'm at the beginning of a Lyme treatment with somebody and they've never taken either Lyme antibiotics or had their yeast treated recently, I sometimes will just start to treat the yeast first without putting them on Lyme antibiotics. And the reason for that is that sometimes when you have yeast overgrowth, as I said, yeast overgrowth triggers too many cytokines, right? And I've said that Lyme symptoms are actually too many cytokine symptoms. So sometimes even though somebody's tested positive for Lyme, it may be that their main symptoms are all yeast overgrowth symptoms. So if I've got somebody that has a lot of symptoms to me suggesting too many yeast in the intestines, I will try clearing that first. And there's maybe about 5% of people, 10% of people or so that if I just do that, all of their symptoms go away. And even if they've had positive Lyme testing, I'm not going to treat for their Lyme because it may be that they tested positive for Lyme, but their immune system really already had the Lyme under control. And all that their excess cytokines and cytokine symptoms were coming from was too many yeast in the intestines, okay? So if I've got somebody that's new to treatment, they're loaded with yeast based on symptoms, I'm going to go after the yeast first without putting them on antibiotics, okay? But if they are somebody that develops yeast as part of their treatment, because the antibiotics can lead to intestinal yeast overgrowth, at times I will do both the antibiotics and the diflucan at the same time. Keep in mind, fluconazole, I'm starting to use as part of my Bartonella treatments because there's some data showing out of Johns Hopkins a couple of years ago that one of the azoles called trimazole that's in the same family as diflucan, fluconazole, was effective against growing and persisting Bartonella. So if I add fluconazole in and they got Bartonella, I consider that to be part of their Bartonella treatment. In addition, the fluconazole could treat cyst forms of Lyme as well too. So if you add fluconazole in, you might be able to remove the anti-cyst agent for Lyme that you're on, and you might be able to remove one of your Bartonella antibiotics if you're on two, and decrease some of the pressure on your intestines and yeast, basically. Okay, all right. And then finally, in terms of decisions about how much to give, kind of think of the doses of about 30 drops twice a day as being for a person that weighs about 150 to maybe 200 pounds, okay? And so 150 divided by 2.2 is going to be about a 70 kilogram person. So, if you've got a 45 kilogram person, you could decrease maybe down to 20 drops twice a day, okay? But it's kind of hard to take too many herbs, and the bigger issue is that you don't take enough. So, but yeah, you could do some adjustments based on weight. Okay, all right. Thanks for that question or those questions. Good luck to you. Hello, Diane. Hi, Dr. Ross. Substitute you can recommend for ATP 360. It contains soy, which I cannot tolerate. Okay, so you probably could tolerate this, but let me say more than that. Okay, so all right, so what? So ATP 360, one of the key components of ATP 360 is a bunch of phospholipid fats that are considered to be the building blocks of your mitochondria membrane. All right, so mitochondria are your cell energy factories, and in chronic infection, due to extra oxidation agents that are made by the immune system, those phospholipid membranes that make up the mitochondria get injured. And so we want to rebuild them by giving you phospholipids, okay? Where the phospholipids are derived from in the ATP 360 is from soy. But the only soy product that is in the ATP 360 are these fats that are cleaned off to remove any other parts of the soy. And so even when people have soy reactivity, soy allergies, they usually can tolerate this, okay? Because again, it is the fat from soy, not the allergic components of soy, okay? So I would just say that you'd probably be okay giving it a try. In terms of products that would not use soy as their source for these fats, gosh, I would have to go search, and I don't know. Because usually what I'll do is I will still use this product in people that have soy allergies, and I usually don't find any problems with my patients, okay? All right. Good luck to you, Diane. Diane, this is one of those things that I probably would talk over with your healthcare provider for sure, because I don't know the rest of your healthcare. And if this really does involve allergies, they may have a better sense of what's going to be the better course for you here. Okay? All right. Good luck to you. Hello, Karen. Let's see. I was bit by a tick in June this year and got a bullseye rash and CDC diagnosed with Lyme and several co-infections, namely Babesia and Bartonella. My protocol has consisted of the 3 weeks of doxy followed by minocycline, hydroxy, I believe you mean hydroxychloroquine, ivermectin, artemisinin, and a host of other supplements. Even in this short time, I have arthritis in my knees and body twitching. What would you recommend for our next protocol to tackle these conditions? All right. So first of all, the best Bartonella treatments will have at least 2 intracellular antibiotics that get inside of cells that target Bartonella. Currently, the only intracellular you have is minocycline. All right. I don't understand why they're using ivermectin here. It is true that ivermectin has some antiparasitic properties. It has no data to show that it kills Bartonella. It has no data to show that it kills Lyme. It may help people with Lyme feel better because it can help modulate the cytokines. But there are some practitioners out there that believe falsely that ivermectin is the miracle drug to cure everything. And the truth is it doesn't. It may modulate cytokines to make people feel better, but we have no science showing it's a good Lyme killer. We have no science proving it's a good Babesia killer, although there's some evidence it might. And then we have no science showing at all that it does anything for Bartonella. So I question my colleagues who keep throwing ivermectin at people. Just my opinion, okay? Now, granted, they can all have different opinions here because there's not a lot of good science on any of this, all right? But my thought would be is that you're not on a fully good Bartonella treatment here, all right? Second, and so the reason I'm focused on that, body twitching is a symptom that often can be part of Bartonella, and it also could be part of Lyme. If I were to look at what's next, ideas to consider would be you could keep up the minocycline, but I would consider adding to it diflucan. As I said, diflucan, although we use that for yeast, has got some good evidence showing it can help with Bartonella in the laboratory in terms of persisting and growing Bartonella. It also picks up what is known as the Lyme cyst form of the germ. Some of my colleagues will use hydroxychloroquine to treat cyst Lyme, but the data there is conflicting. The data says it might treat cyst Lyme, but there's also data that says that it promotes cyst. All right, so if you were my patient, I would probably get rid of the hydroxychloroquine. I would need to know more about your Babesia symptoms to fully recommend whether you get rid of ivermectin and artemisinin or not. I just don't know. I can tell you that the arthritis and twitching has me thinking Lyme and Bartonella are active. I would need to ask you a lot more questions to find out whether Babesia is, okay? But at a minimum, I would strengthen your Lyme and Bartonella treatments by doing minocycline with diflucan. Again, diflucan is a full Lyme treatment. It picks up spirochete and it picks up a cyst Lyme. The diflucan picks up cyst. The minocycline picks up spirochete and intracellular. The minocycline diflucan picks up Bartonella, including persisting Bartonella. I would get rid of the hydroxychloroquine if you were my patient. And I would want to know a lot more about what's happening Babesia symptom-wise to determine if you should be on ivermectin or artemisinin or not, okay? Lastly, one other thing to consider adding, and again, you should talk this all over with your provider too, because they know more about you than I do, okay, is getting on something for persister Lyme, okay? And so what can help with persister Lyme, and also in addition helps persister Bartonella, is to be on liposomal cinnamon, clove, oregano. I like using that combination, and that's 1 pill twice a day. Okay, all right. Good luck to you, Karen. I'll do a quick screen share here because I've mentioned this a few times. I just want to show you guys a product here. All right, so this is my supplement store, Marty Ross MD Supplements. This is where my patients get their products, but anyone can get products here. So if you're ever wondering what it is, and when I talk a generic like curcumin, what do I recommend, you can see here. But also keep in mind, I curate my store and offer products that have a proven track record of working, okay? So if you're looking for products that have a good chance of helping, keep in mind, I've done that curating for you, okay? So the product I recommend for the liposomal cinnamon, I'm just going to type that in, liposomal cinnamon, clove, oregano is this product made by Hopkinton Pharmacy under their label called Doctor Inspired Formulations. And it's the cinnamon, clove, and oregano essentials, okay? And that's 1 pill twice a day. All right. Good luck, Karen. Hello, Denise. Let's see. Thank you for all you do. You have helped me greatly with chronic Lyme. Great. Yeah, great. That's, you know, as you all know, I do a lot of stuff here. I mean, I write articles. I just put that stuff out. And I do these webinars. My whole goal is to help as many people as possible. So I'm glad to hear that. Thanks for sharing that with me. Let's see. This question is about my grandson, age 22. Last week, he was diagnosed with mono and simultaneously Lyme. He has an enlarged spleen and liver damage, meaning his enzyme and other liver readings were concerning. His primary doc doesn't want to start antibiotics for the Lyme because of the liver issues. Do you have any suggestions for what could be used to help the Lyme while being gentle to the liver? Boy, that's a hard condition. So let me just, I'm not sure if I'm going to have the greatest answer for you, okay, but just let me try to say a few things here. So keep in mind, if they diagnose Lyme, it may, mono can give a syndrome that looks just like Lyme, okay? And because he tested, whenever somebody tests positive for Lyme, we have to make sure that it isn't something else causing the problem. Just having a positive test does not mean the germ is active and giving you problems, okay? So if he's got mono at the same time he tested positive for Lyme, it doesn't necessarily mean he's got active Lyme. I just want to say that, okay? It's probably going to have active Lyme at the same time, but if it's acute mono that he got, and this enlarged spleen would probably suggest that to me, I would probably wait for that to quiet down first and take care of that, and then see if you're left with a lot of symptoms that suggest Lyme at that point or not. Okay, that's one consideration to think of. Okay. Secondly, it's interesting in that liver enzymes being elevated means hepatitis, means liver inflammation, okay? And the various viruses can do that. So the monovirus, Epstein-Barr, can sometimes give you a hepatitis, okay? It can give you spleen inflammation too. But also, and there are a number of other viruses that give you hepatitis, and the more common ones are called hepatitis A, hepatitis B, and hepatitis C. And given this liver inflammation, they may want to test for those as well too, okay? I have had some patients before that tested negative for all the viruses and still had hepatitis, that in the end, and their hepatitis wasn't getting better, and I really thought we needed to treat their yeast, and I started them on antibiotics anyhow. And it was using antibiotics that got their liver enzymes to go to normal. And so I think that Lyme at times can lead to a hepatitis as well too. Now, is that a prevailing attitude? Is there a lot of science that supports that? No, but I have seen it happen a number of times in my practice where I just choose to go forward with the antibiotics while supporting the liver, and the hepatitis resolves, okay? So if I do choose to use antibiotics and somebody that has hepatitis, I'm also doing things at the same time to support the liver. And this is something I would recommend for your grandson as well. Glutathione. Okay, so glutathione is the reparative, restorative antioxidant that is made in every one of our cells. It fixes damage. It's made in the high amounts in the liver because it's also used by the liver as part of detox. But if the liver is inflamed, it will sometimes exhaust its glutathione supply, which leads to more inflammation. So you can fill up the glutathione gas tank, okay? And so the way I like to do that is a research nutritionals product called liposomal glutathione. And their product is, the name of their product is called Tri-Fortify. It's TRI-FORTIFY. And I have people take a teaspoonful one time a day, but with really bad liver inflammation, I'll have people take 1 teaspoon twice a day, okay? Now, herbs could also inflame the liver too. And so in a situation, I don't know enough about why they're saying he's got Lyme, but again, it could be, keep in mind that what looks like Lyme could all be mono, okay? All right. But if you do decide to treat the Lyme, I would definitely do things to support the liver. And if this was my patient, I would, based on what you wrote here, I would hold off on going after Lyme until we see what happens over the next month or two as some of the mono seems to resolve, okay? The enlarged spleen has me thinking this is more of a mono problem, okay? Lyme doesn't lead to enlarged spleen typically, okay? All right. Good luck to you, Denise. Good luck to your grandson. Hello, Steve. Hold on here a minute. All right, let's see here. Good afternoon, Dr. Ross. Thank you for running these webinars. You're welcome. Let's see, around 1.5 years ago, I tested with the German lab and had a weak positive on the Ellis spot test. I also tested using a test called the TickPlex Plus for co-infections and had a positive for Rickettsia arari. All others was negative. I treated with herbs for 6 months with no effect, no herx, or change in symptoms. I then went to an LLMD and treated for 8 months with antibiotics and no changes or herx reactions. I tested again through IGeneX and had low intensive positive for 3 bands on the immunoblot IgG. My symptoms are mainly twitching muscles, occasional brain fog, neck grinding, occasional fatigue, and my left leg feels off. Where would you be looking next, and what would be your recommendations? So, Steve, keep in mind, I just have this limited thing that you wrote me here, okay? But just a few things to think about, and then I'll tell you what I would suggest based on what you wrote here. I don't get to do a lot of questions with you that I would like to be able to do. So the German lab probably was Armin Labs, and they or it could have been Infecto Lab too, but they do this technique called an Ellis spot. An Ellis spot is a test that measures whether your T white blood cells have reacted against these infections. Okay, the way the test is done, we take your T white blood cells out of you, we put them in a test tube, we introduce the proteins from Lyme into that test tube, and then we see if those T white blood cells make cytokines, and depending on the level of the cytokines determines how reactive it is. All right. Your T white blood cells have a lifespan of 2 months, and so if they react against a germ, that means they've seen it sometime in the last 2 months. The trouble is with this test is that it's wrong 15% of the time. Okay, so it either misses it 15% of the time, or it says it's there and it's not really there. Okay, so I prefer not to do ELISpot testing, to be honest. Okay, Armin also has come up with this TickPlex, which is really a screening test that when it comes back positive, it might be positive because you have one of these infections, or it could be you don't have it at all. And what we're supposed to do then off of a TickPlex is then do a confirmatory test to see, do you really have the infection? Another type of test, okay? All right. These days, I think the best lab in terms of testing is hygienics. Your symptoms of grinding in the neck is something we see in Lyme. Your brain fog, muscle twitches can be part of Bartonella and Lyme. Your occasional fatigue can be Lyme, could be Bartonella. Your left leg feeling off sounds neurologic, which could be Lyme or Bartonella. Okay, do you hear the word Bartonella showing up here a number of times? Okay, so I don't know what they did with your IGeneX test, but I would make sure that they did an IGeneX immunoblot to see if you had Bartonella too. And the immunoblot is a technique we use that measures whether you're making antibodies against the germ. The immunoblot technique that IGeneX does is it looks to see if you have antibodies against 4 specific kinds of Bartonella and against the family of Bartonella that includes these 4 specific strains, but also includes the other 11 strains that you might get, okay? That could cause you problems too, right? So it's the most comprehensive test that we got out there. It has the potential of finding Bartonella if it's there about 90% of the time, all right? So I would consider retesting to see if that's what you got. And then also in terms of your Lyme test, I would want to make sure that they did the Lyme immunoblot. All right, so go back and see what Lyme test did they do, because IGeneX offers a number of them. But the best test they offer these days is their immunoblot. And their immunoblot basically looks to see if you're making antibodies against 8 kinds of Lyme germs, okay? All right, so I would want to look there. But I would also want to look and see, do you have Bartonella? And if that came back negative, but based on these symptoms, I might still consider treating you for Lyme and Bartonella. I would look back and see, did your previous provider that you worked with for 8 months do anything that targeted Bartonella? And again, you want to be on at least 2 drugs that target at the same time. In your review, you could look at my article called Kills Bartonella, a Brief Guide, where I give you various, I lay out many different scenarios that would treat Bartonella, but you might want to look back and see, did they do any of that as well too? Okay, all right. Good luck to you. Hello, Eileen. Dr. Ross, I read much of your programs and have a question about the mitochondria part of your program. My choice of research nutritionals is ATP 360. It has CoQ10, but you also list CoQ10 400 milligrams. Is that in addition to the ATP 360? So in terms of, let me answer that. So in terms of doing mitochondria repair, mitochondria support, again, mitochondria are your cell energy factories. We estimate there's 300 to 400 per cell. And when you have chronic infections, sometimes those mitochondria get injured. There are a minimum of 2 things I suggest that people do, and there are a couple other things you can do, okay? So the minimum of 2 things is to do a product that repairs the phospholipid membrane, and that would be the ATP 360. In addition, ATP 360 happens to have a number of nutrients that help the mitochondria work better, including coenzyme Q10, small amounts of it, okay? In addition to emphasizing the repair of the mitochondrial membrane, I also suggest being on a good antioxidant, glutathione, to repair the mitochondria from the inside, and that's to use the Trifortify product, also by Research Nutritionals, okay? In addition, sometimes it is helpful to do two other things. For vegetarians, I recommend that they also take something called L-carnitine, acetyl L-carnitine. And what carnitine is it's a protein that you get by eating red meat. Okay, so if you don't have red meat, you're probably not going to have enough carnitine. Carnitine is used as a transport vehicle to carry fat from the outside of the mitochondria into the inside of the mitochondria where it can be burned into cell fuel. Okay, so vegetarians, I recommend that they take acetyl L-carnitine 500 milligrams twice a day. Okay, and for people that are really having extreme difficulty with energy, in addition to the amount of coenzyme Q10 you get in the ATP 360, in addition to it, I would do 400 milligrams twice a day of coenzyme Q10, specifically to supplement that. And what coenzyme Q10 is used for is inside mitochondria. It helps carry electrons that are part of the chemical reactions that generate energy. Okay, all right. So Eileen, it all depends on how severe you are. If you're really severe, I would throw in the coenzyme Q10, and that's one pill twice a day on that, in addition to what the ATP 360 is. Okay, all right. So let's do a quick screen. And good luck to you, Eileen. I'm going to do a quick screen share here, everyone. All right. So if you're looking at probably what Eileen was reading is an article I have on what do you do to repair mitochondria. So take a look at the energy and fatigue chapter here. And this article called How to Fix Mitochondria and Get Energy in Lyme Disease. Okay. All right. Good luck, Eileen. Hello, Sarah. Let's see. Can you have Bart and Babesia without Lyme? How accurate is muscle testing for diagnosing Bart and Babesia? Yes, you can have Bartonella and Babesia and not have Lyme. Although if you have those, the chances are you probably do have Lyme. Okay, so you could have, if I had somebody had Bartonella and Babesia by testing, for instance, and their Lyme test was negative, I probably still would treat for Lyme because there's a high probability Lyme is there. All right. So, for instance, we know from tick studies out on the East Coast that around, let's see, I think it's 70% of tick, 75 or 80% of ticks, I think, that carried Lyme also carry at least one other co-infection, either Bartonella or Babesia. And at least 60% carry two co-infections, all right? So that would suggest if you've got Babesia and Bartonella, there's probably a high probability you got Lyme too. The test just may be negative, but the testing, again, is not perfect for Lyme, no matter what test we do, okay? And then in terms of muscle testing, gosh, I wouldn't rely on it. You know, there's muscle testing is energetic testing, and that is only as good as the practitioner's ability to feel things. And there's no way of validating whether they're good at it or not. A test, a blood test, is much more reliable. It can be validated, okay? But energetic testing is not, it's really dependent on who the practitioner is. I think some can do it well, but gosh, I wouldn't hang my treatment on whether somebody did a muscle test to figure out whether I have a germ living in me. I don't consider it to be the most accurate way of knowing for sure. Okay? All right. Good luck to you, Sarah. All right, let's see here. Let's see if I got time to do one more. Let's see what we got over here. Hello, James. Let's see. Thanks for everything you do. Can you take lumbar kinase with low-dose naltrexone and losartan for blood pressure? I noticed the increased heart rate when taking lumbar kinase with blood pressure meds? Also, have you noticed any patients getting anxiety from lumbar kinase when they add to their regimen? Also, does lumbar kinase cross the blood-brain barrier for those with neurologic Lyme? All right, so lumbar kinase, everyone, is a group of enzymes that comes from the skin of earthworms. I love this crazy illness, and we have to resort to earthworm skin. We use lumbar kinase in Lyme disease for a couple big reasons. One, it can help break down the proteins that are found in biofilms. Biofilms are slime layers that are held together in a protein matrix made up of a blood clotting protein called fibrin. They cover germs, and they make it harder, but not impossible, but harder for antibiotics to get in the immune system to see the germs. Okay, lumbar kinase can help break those down. The other reason we use lumbar kinase in Lyme disease treatments is as part of a Babesia and Bartonella treatment at times. And that is, we think that in some people, their Bartonella and Babesia will mix together with the fibrin in the bloodstream and form these fibrin germ nests, not biofilm, there's a separate thing. And they attach to the blood vessel linings, and they become hard to get at, basically. Okay, so lumbar kinase breaks down the fibrin in that too. I will tell you, I haven't seen anyone in my practice. So anyhow, does it cross the blood-brain barrier? I don't think anyone's done studies to know for sure. Do I think it does based on clinical improvement of my patients in terms of the neurologic Lyme symptoms? Yeah, but I have no science that says it does. Okay, and then in terms of anxiety from lumbar kinase, no, I have not seen that. And no, I have not seen any heart rate differences when people take lumbar kinase, okay? Now, there is a Marty Ross rule of medicine, okay? And what that rule is anything can happen to anyone with anything, all right? So there are common side effects that are reported for any medicine or supplement, but there are the things that happen in real people in the real world. And they may not be the average symptoms, but if you introduce something and you get new symptoms, it's probably coming from that something, okay? So you may be having a side effect, an uncommon side effect to the lumbar kinase. And you'd have to decide whether these are tolerable side effects for you or not. I would not have a specific recommendation on how to deal with either one of those, okay, other than stopping the lumbar kinase. You could, if you do decide to stop the lumbar kinase, another option you might want to look at is a weaker enzyme called nattokinase. Maybe you won't have the reactions to it, but I will let you know nattokinase is substantially weaker than lumbar kinase is, okay? All right. Good luck to you, James. All right, everyone. That is it for me for tonight. It's been great being back here with you again. I know I was gone for a couple of weeks there. We have another webinar next week. I hope you'll join me for that. And keep in mind, again, it's on Wednesday, not on Thursday. Tomorrow morning, keep an eye out on your email. You get an email from me announcing that the recording of the webinar is ready to be seen. And in there will be a link to sign up for next week's webinar as well, too. What I do request you do, share these emails that you get with me with other people that you think might get benefit. If you're getting benefit, they're going to get benefit too. And again, my goal is to reach as many people as possible and help them recover from this illness. And so help join me in that, okay? All right. So good night, everyone. I've enjoyed being with you here tonight. I hope you have a great remaining days of summer here. I guess we have till September 21st. Even though I guess we're all back in school and back in work now and everything else, but I still consider this the official period of summer. So enjoy what's left of it, okay? Good night, everyone.